Thank you very much for the faculty to invite me to present some of my work. It's quite interesting topic that today I'm going to present about assisted reproduction. Is quite different from the brain and ADHD. So you have to change switch your brain for a bit. Today I'm going to talk about the role of bioengineer. So it's quite a different view that in the engineer might be see of the way to assisted reproduction in a different way. So today my scope of my talk is just talk about the introduction of reproduction. That I think everyone get used to the reproduction because it's everything's something in our life that we need to have a baby, and we have to have a normal reproductions. And if you have a problem to get stuck with to have a baby, the role of assisted reproduction technology, that how can we use that, and how about the biotechnology that we gonna apply to the future, and about the gamete cryopreservations. So I think everyone knows about the problem of our country, in our world. The world population, it seems like declines rapidly. I mean, in the future, we might not have more population to work, and we have to change our life. And it seems even in Thailand, you can see in the graph, it seems like in younger age, it seems that the number of the population, it seems, is not higher compared with the past, but the old patients and old population, it seems, over the younger age. So if we still have a problem like in the population have a very low children, maybe in the future we might have a problems. It seems like infertility is very common problems in our country and in our world, and it seems like a majority of my couples fail to have a baby spontaneous conceived. And infertility is the problem that they might need some help. The assisted reproduction technology might be the way that we can use that. And for example, like intrauterine insemination or in vitro insemination or test tube baby. But the advanced technology, it seems like the succession rate is not too high, and they still have more room to go for the gamete processing, medical equipment, or computer technologies, and even in the AI that we can use in the future to improve the succession rate of the treatment. So if we talk about assisted reproduction, what about the medicine might be the one that you're gonna see, like you have more technologies about the advanced technology to use that. I mean, in the past we used like biological technologies, but now we have like genetic engineering to make more sophisticated and like complicated medicine, or even the gamete, about the gamete manipulations or cryopreservation or genetic testing. The law of bioengineer that I am trying to put them together. I mean, I can group into 5 groups. The first thing that we can do, like some efficient method or biomaterials or equipment for selected gamete, because we know about a male egg in females or sperm in the males, and I have evolved in the succession of them, become like a baby. And even like we have the way that to select it out and put together and try to force the fertilizations, but it seems like the outcome is not, as we expected. The method or equipment that we use to cryopreserve the gamete, that when we produce a gamete, how about can we use about excess gamete? How can we store them? The cryopreservation might be the way that to keep it. And in some couples or some women who try to have a plan, I mean, and like working styles, and need to have a baby in the future, but sometimes the age is not right, and then they have to freeze the egg before they plan to marry, before they plan to have a baby. That's one that we have to have very like a method that's effective to keep the gamete. In the culture and molecular system, and when we have egg or sperm and we do the embryos, we have to try to have a culture system like a national culture system that to maintain the embryos. And the other thing is just for chromosome testing. And we know that now we have a high technology of computer, and we can use to check the genetic testing to select the good genetics to transfer to the baby. Or in the future, we know that we have artificial thing a lot. For example, like an artificial womb, we can make artificial womb, or can make artificial heart or sperm or egg. And in the future, we might change another page of the treatment. So if you see the pictures, you can see when in a normal anatomy of females in the womb, when the sperm and egg made together, where so we have to know that in every month the woman have a spontaneous ovulations in every month, and the egg have to transfer to the tubes, long way, and they have to make the sperm in the middle of the tubes, and that way try to fertilize and divide into 2 cells, first and egg cells to become the embryos and implant into the womb in the future. And if they have something wrong with the like communication, like a sperm and egg, so they fail to conceive or they fail to fertilize. And we know that in vivo, I mean, in every month, the woman should have the egg at the beginning. You can see that the very small circle of the black is maybe is called antral follicles. It's an egg. They should have like 8 to 12 in every month should come, and finally they have 1 egg, like to become like ovulate, become like the ovulations and become like maybe if they have fertilized. And the egg should be controlled by the brain, and they have to produce in the orchestral way of the LH and FSH, that the way to control the egg in every month. And you can see if the egg and sperm should met together in the tubes, that so it's kind of like this natural selection, that if the sperm cannot swim into the tubes long way, it means the bad sperm cannot swim into the tubes and make the good eggs. So it's kind of like natural selections that select the good egg and sperm. That's why we haven't seen any people who have handicap a lot. And for the treatment of infertility, one is called the IUI, or entitled inseminations. This kind of like natural selection that we try to make and sperm to mate together by to do forced ovulations and timing of the ovulations. And we can do sperm preparations when we get the sperm for the males and do sperm preparation, inject to the womb. That's kind of like fertilized, natural selection, because the egg have to go to the tubes and the sperm have to go to the tube and mate together, become like the embryos. So if they have something wrong for the ovulation or have an abnormal anatomy of the female, so they fail to conceive. And in the past, everyone familiar with the word of the gift. The gift is come from a gamete metaphorical tube transfer. At the beginning of the era of the treatment of infertility, and the doctor who do the laparoscopists and the biologists that who do about the embryo culture met together in the conference, and they have the project that to do something special. I mean, they try to collect the egg and collect the sperm and try to collect and then put them together into the tube while do the surgery of laparoscopic surgery. It's called the gift. It seems we put the gamete inside the fallopian tubes. You can see this is still of natural selection because we still need more normal female anatomy. So it means in the past we cannot do the culture the system like the tube. So that's why in the past we cannot do a lot of treatment. And in 1978, is the first baby born by test tube from Patrick Steptoe and Robert Edward. It's called Louis Bow. And now we know Louis Bow have the baby already. So it means the baby come from the test tube baby is complete of the circle of life. But but now we have to another step of the treatment, because we know in the past we cannot do culture the embryos, because the way to culture them, we have to copy the atmosphere from the tubes. And the way that we try to do, because now we have like a technology of the medicine and about technology of the embryo cultures, we can do is for the fertilized in vitro. It means we can put into the interpret by to let the sperm, you know, in a normal amount of concentration and egg and fuse together by themselves. And then we can culture in the incubators. So they have a condition resembling to the tubes. And but in the womb, we have to correct into the womb. If the womb have like a disease, we have to fix them before we put the embryo back. So you can see for the assisted reproduction for the IVF. So the procedure of IVF, we have to collect the egg, you know, from the ovary and put them and let the sperm fertilize. And when they culture for the become the embryos, we can put them back from the cervix to the womb. But so this is artificial things. But for the IUI, so it's like natural because we have to let the sperm swim to go to the egg. So the indication of the treatment is quite different because if for the IUI, for the natural way, we have to the male have to have a normal sperm concentration and sperm motility. Sperm have to wait swim by themselves and have to normal tubes. But for the IVF, if the patient got stuck with a low number of sperm or have abnormal of the egg, or even have an abnormal of the fallopian tubes obstruction, we can take the egg out, you know, by do the procedure and do the fertilize outside the body. How to collect the egg? So at the beginning of the month, the egg, you can see this is an ovary. We expect to get the egg to 12 eggs inside in one ovary. If you can see in the histopathology, you can see the small egg, you know, inside the ovary. And in every month, the egg should go only one, become like one egg and fertilize into one baby. And maybe you see from the other cells, like in the black side circle, it seems like you know, like egg, and but the small egg, real egg is very tiny. It's compared with the follicle. It look like, you know, the egg box, but the egg is very tiny inside that. But in the most patient have the problem get stuck with a low number of egg at the beginning like this. You can see have no egg inside the ovary. But even she have a disease is called like endometriosis or chocolate cyst inside the ovary. That's why they destroy the normal tissue of the ovary. But now they have a lot of things that to treatment of the patient, like medicine. Now they have different medicine that, you know, I mean, in the past, they have to use a FSH that's a hormone. The hormones that come from, you know, it's a hormone is higher in a menopause woman. In the past, when we try to collect the biological product, we have to collect the urine because we know in the menopause woman have a lot of urine inside the pee and urine, and the urine that they try to hydrophilize and, you know, I mean, extract the hormone and fill into injections. So you know, injection is come from biological product. And then the hormone that can produce more egg become like this. So not only one egg, but a lot of eggs. But they have a lot of things because it seems like demand of the urine is a lot. I mean, in the past, it seems like for the demanding is a lot. You know, it's not enough for the people in the world. So now they change to the recombinant FSH. So it's like the COVID. I mean, they use like biological engineer that try to produce the FSH artificials, and they try to purify into the pin. So the technology is now high, you know, I mean, it's good for the product that they can do by themselves and purify enough to use injection into the, you know, tummy. But in history of the medicine, you can see is at the beginning they have to like extract the FSH from the urine, from the cadaver, but now they have a recombinant is the place of the urine. So a lot of medicine just, you know, just disappear. So the source and the medicines is depend on a lot of, you know, like a type, source, and route of injection or demanding. But when you get the egg out, how can you manipulate the eggs? So in the procedure of the IVF, we have to take the egg from the ovary. So you can see this egg. We have to put the needle inside the follicle to take egg out. So we do the ultrasound scanning when the egg just, you know, just big enough, and we aspirate the egg out, and then we can see from the microscope the egg is very tiny. We cannot see by eye. We have to use under microscope. And when you see the egg, this is the egg, you know, tiny eggs. look like the egg and with cell surroundings. So it's called the complex of the eggs. For conventional IVF, when we take the egg out, we put the sperm, to fuse together. Is they can overcome the infertility by, if the male have a very low number of sperm, we can put them together and they have a chance to fertilize by themselves. But if they get stuck with the fertilization, we can do the ICSI by to put the sperm inside the egg, one by one, so they can force fertilization. But for the sperm, because one egg with one sperm, we have to select very the best sperm. If sperm is abnormal, it means we fail to get the normal embryos. So this is a video of the ICSI. You can see we try to select a good sperm and try sharing them to induce the activation of the eggs and spread them into the injection needles. And then we met egg and try to inject the sperm. You can see the sperm is the sperm inside the needles, and when we put the sperm into the needle, that's an ICSI. But you can see the ICSI, we need one sperm for an egg, so it's quite difficult to find a good sperm. Even we try to routine preparation to find the monitoring of the sperm to find a very motile one. But it seems like a lot of, we cannot see like genetic material inside the head of the sperm. So even we have a routine for the try to select a good sperm, like try to use density gradient by to use mass of the sperm, and they try to use like ingredient of the media to select a good one. But it seems like it's difficult to obtain the very good sperm. They have a method like to use like a magnetic fields, or even use like microfluidic, or even like it's called try to use high magnify. It's called IMSI. But it seems like it's quite difficult to obtain a sperm. That's the one that we have covered with Dr. Suchi too, and Dr. Pisini to do the way try to save the sperm use fluidic in the future. When we get the sperm and egg and fuse together, and we have to do the fertilize, and then after 5 to 6 hours of the insemination or ICSI, they can see like the nucleus of sperm and egg to fuse together, and then they become like 1 cell, 4 cells, and try to show the mitosis. But it seems like in the past, we have to use a conventional system that we have to take the embryo out and look under the microscope and evaluate the grading of the embryos. But now we have a real-time system, scoring system, that we can see the embryos inside the computer, and they have a scoring system to give us a scoring to select the good embryos. But it seems like when we have more embryos, we have to get more eggs. When we have more embryos, and most of them sometimes it's too many eggs, too many embryos to sperm. We have to cryopreserve the embryos. The technology allow us to be conservative of cryopreservation of the gamete. But the way that try to cooling the cells into that sub-zero, we know about the problem. And they have 2 ways to freeze the embryos or to freeze the gamete. It's called slow freezing or vitrifications. Vitrification is when we have a normal cells and we pass through the temperature into the cold system. And if they pass they freeze before they become like the ice, it's called vitrification of the cells. But if we try to decrease the temperatures very slowly, the time around the fluid out to the outer cells, it seems like if the fluid it cannot go out, some other fluid become like the ice, and the ice can kill the cells. So that's why we have to have the very good cryoprotectant or good the machine to try to freeze the embryo in the right time and the right place. And this is for example of the cells when they have like an ice crystal formation, they kill the cells. So that's why the freezing thing is one of the important steps of the treatment. For the egg, you can see this egg. When we take a cell out, you a lot of eggs and egg the frames. And if we have the egg freezing, you can see a lot of egg, inside it contain a lot of water, and a lot of the genetics that they have, like it's called microtubule, that is some kind of life structure, very tiny and fragile. If they have like a culling shock, maybe it's a destroy of the quality of eggs. So you know about it now they have a lot of women who try to keep the egg freezing before they use, and some of them is because they have a cancer, they have to freeze them before they treatment, because otherwise they have no egg futures. And some of them, they have a genetic conditions that they have lots of egg a lot, they have to freeze the egg before, or even try to unable to preserve embryos or just donor oocyte. So in our hospital, in Silat Hospital, they freeze the egg in 2,000 eggs, and now the post-sol survival is nearly 100%. And for the sperm, they have a lot of cases they freezing per years, and it seems like the same of the eggs, because they have like a water, but in water and sperm it seems like it's not too much like the egg. So survival of sperm is quite good. But now they have a lot of methods to do. So in our clinic, that we try to do the research to try to select the good the way to freeze the sperm, and we optimize the method of the freezing. We optimize the technique of the freezing, and we use like a supplement of the ovulation, and we try to use equipment to freeze the sperm in the past. Even in the embryos, they have a lot. They have a lot of embryos that a lot of embryos they have to freeze in per years, and now the succession is nearly 100% true. So until now they seem like a lot of cases of fertility a lot, and they have a lot of embryo that we have to freeze them for. And nowadays the thing that in the technology that we cannot talk about is a pre-implantation genetic testing. Even we to use the normal embryos to check for the normal genetic like an abnormal chromosome, for example, like Down syndromes, or in the like disease like thalassemia. So now we can check genetics of the embryos before we put them back into the womb. So it seems like the succession rate of the treatment, it seems like higher and higher. In the past, we expect to get like natural conception is to be like 30%, but it seems like for the IVF, it seems like it's go higher than 30%. And for the technique like a PG or NGS or genetic testing, it seems like it's a go up for the succession rate. And in the future, we expect to get more. So as the picture, at the past when we do the IVF, we think like, it might be one switch or one thing that we can do for the treatment. But now it seems like they have a lot of things that we have to consider. I mean, they have not like easy like we look. And for conclusion in this talk, you can see like the gamete selections is the highest quality of the gamete we actually can pass through a genetic material to the descendants of the baby. But it's still more challenging to overcome the limitation of difficult case, or even like and now it seems like the patient come to see us is like nearly 40 years old. So it means it's nearly approached the menopause. So we have to have a more challenge to treat that group. And medical engineer is one of the opportunities that improve enhance the fertility outcome in the future. So it seems like not only the doctor, nurse, or pharmacist, or scientist, but engineer is one of the role. And in the future, we have to work together to improve the treatment. So this is final slide. If you have any questions, you can ask me from the email. Thank you.
Thank you very much, Professor. It's very interesting and very suitable for ones who want to have a baby like me. Any questions from audience and attendees, committees, please?
Okay. You have talked about, you say like people have started to use AI for like reproductive medicine. Can you share with us like what sort of AI that have been done for like reproductive medicine?
I mean, for AI now they use just only to like I told you last time, they use the machine and use the AI try to predict the fertilization rate and how to obtain the like quality of egg and sperm. But because from now research, because as you know that we cannot let the sperm or egg outside the body for a long time, so that's why they cannot take a long time to take it. So I think it's more challenging in the future.
And another question is I have heard like two very interesting words from your presentation: artificial sperm, artificial egg. Like, is it really happening? Like, can I turn my sperm into an egg for fertilization? You know.
I mean, the thing that we cannot know that, you know, I mean, we still have a Pandora box a lot. I mean, like we cannot know about the sperm cells that come from the embryo, from the baby. And because for when we become like male, females, and the genetics materials that, you know, just determine the sex already. But in the field of the research, we can try to reverse the material. For example, for the stem cells, we can take the stem cell out from the females and try to make the sperm.
Oh, that is really interesting.
But for the animal models, you know, it seems like for the stem cell, we can make a sperm egg artificial. But for the humans, quite, you know, more difficult because we very complicated.
I see. And one last question from me. I'm wondering, for it seems like most of the cases that require like cells freezing was with the women, more or less. But is there any case that you need to freeze sperm in some condition?
It's a lot. I mean, for example, I mean, it's the same. I mean, if even women or males who suffer from the cancer and to get the chemotherapy, they're gonna use like, you know, it's called toxic to the testis or testis or ovary. I mean, if you get the treatment, the sperm is gonna disappear. So most patients have to come to see me to feed the sperm.
So it's common to collect sperms.
Yeah.
I see. Thank you. And that's all for me. And is there any other questions from the audience? Please feel free to ask or leave the questions in the question box. We have time.
Actually, we can leave the questions in the chat room as well. It's welcome for all audience, committees, and students. All right. Any adjunts? So I have a question. How do you know that when you inject the sperm using some injections or silings, you won't destroy the DNA or the head of the sperm?
I mean, in the ICSI, right? In the ICSI.
In ICSI, I saw you're using.
I mean, in the ICSI, you have to use a micromanipulation. I mean, it's a microscope with it's a micromanipulators.
Sorry, then. Okay.
And they are test in the genetic material that have positions and under the cells. So that's why we have to put the right positions. Otherwise, we're gonna, you know, when we put the needle to the egg, it's gonna destroy the chromosome. So they can see the spindles of the nucleus before we put that. But, you know, I mean, even we have a machine, but, you know, I mean, in the routinely, we know the position of the spindles.
Thank you. And yeah,
I have some questions.
Okay, all right, sure.
I appreciate about your speed. You talk about the way for cooperating between BME and MD in the future. I would like to know about the way or the how to cooperate, how to make the cooperation between BME and MD in the future in the practical way. Thank you very much.
I mean, we get started with Dr. Sujit that we try to make the equipment to select the sperm. I mean, it's easy to at the beginning of us. And the second thing that for the AI, I mean, and now they try to use, you know, less labor. I mean, use because now they have a obsession with about the skills, and they try to use a machine or like the AI to produce more information to us. I mean, in the future, if we can try to use some AI to apply, I mean, even into the monitor of the gamete cells, monitor of the fertilizations, or even like to make more. I mean, it might be easier to us to enhance the pregnancy rate in the future.
Okay, thank you so much.
Thank you. So any questions from, I saw Dr. Jenny, you raised your hand, right?
Yes, thank you
Okay,
for your
please.
presentation, John Somsin. I have a question. Back in like maybe 100 years ago almost, there was a book called A Brave New World. Yeah, Brave New World, right? And in that book, they grew babies in jars, like part of the, it was a science fiction book, but the babies were grown in jars, and I wonder if you think that might be coming sometime in the future.
Yeah, I mean, now they try to, even like the sci-fi movie, you can do in an animal model, they can make artificial womb. I mean, they can make like a machine, and they can put the embryos inside the like a machine that can like a womb, and then they can let I can't remember, sheep or a lamb. They can grow, the from the baby become like a mature lamb. So I mean, the future they can grow the embryos. I mean, even we might take the cell out. If you go for the market, and some people just get your cells. They might do cloning your cells, become your genes, second gene.
Oh, thank you.
All right. Any questions from audience? We can have a few minutes. Okay. Okay, if there have been no questions right now, we can move to another invited talk, right? Okay, thank you very much, Ka Ajahn Somsin. That's very
Thank you very much.
interesting.